Welcome to Bite Size Dental Marketing. Today I have Ian. Ian,
Hey, hey, hey.
I'm so happy to be back. I was
It,
in Florida for 3 days, which is 2.5 days too many.
Florida man.
Florida, Katie was going to be so proud that we were becoming a Florida man. We did all the Florida stuff.
I had some late nights, had a good time. But you,
Hmm.
from what I've heard, the event was a massive success. Everyone had a fantastic time. You saw some of the clients, and it was a good time. So I'm happy to hear that.
It actually ties in today to what we want to talk about, and that's building patient loyalty. Yeah, the conference was amazing. All Star and Alex and Eric Vickery put on a great event. And while they didn't get into patient loyalty specifically, they did talk a lot about the adjacent topics of appointment and getting folks on the schedule and different things that all lead to patient loyalty. But I wanted to talk today about what are the great offices doing that build their patient loyalty,
Mm.
and they're not complaining about people don't accept treatment. They're not complaining about people are canceling. They have rock solid schedules and amazing treatment presented numbers. So let's talk about what they're doing.
Being different. I think and I know that sounds.
Hmm.
Any dentist listening to this will go now. Will you all say that? Be different than your competitors. What does that mean? While many people would think, or many dentists in this case would think that it's this elaborate plan, often it's just being consistent as a
Or,
dentist in showing your patients that you're not treating them just like any other patient. The one
yeah.
thing that we've spoken a lot about is surprise and delight for dentists. Whether that could be knowing that in a last appointment somebody said they have their wedding coming up, or they have their kid is graduating from university, or something that is really dear and special to them, and then to follow up on the next time you talk to them, or to send them something. And of course I know that you can't send, if you have over thousands of patients, to everyone, but being selective in who you surprise and delight
You
and
know, you
who's
know who
important
your,
to you.
yeah, you know who your high value patients are. To me,
Exactly.
as you talk, I think you have to develop a series of little systems and processes to help you. And, when you talk about surprise and delight, I think at the daily huddle, when you're going, and I hope they're having a huddle. I mean, I'll say,
Hmm.
I hope they're having a huddle to go over their schedule. I think one of the easiest things to do is ask who knows. Hey, does anyone know about Ian? Does anyone know what's going on in Eric's life? And just a refresher to remind the dentist about when they walk into the room that that this is something that Eric likes to talk about, or this is something that
Exactly.
Eric likes to talk about. And on the pre-show, we were talking about, is patient loyalty or customer loyalty a myth, and customers are only valuable as long as you're useful to them.
Hmm.
I I think that there is some loyalty in the dental space. I think there's some loyalty in the services. Like, I think liking someone generally
Being
makes you
comfortable with
being
someone. Yeah.
comfortable. I think having to go through the new patient experience and all that is a barrier to leave a practice. I actually think the bar is pretty high to leave a practice, but I think the bar is low for really amazing patient loyalty. And I think the first one is just talk about them at the daily huddle. Who here knows Eric?
Yeah. Who's
What
coming in
what
today? Who's
who's
the
coming in
patient that's coming in
today?
today? When last
What?
can we go check our records? What did they mention to us last time? Did they
Mhm.
mention someone that's important to them? Did they recently have a loss in the family? Did something happen? Because showing that, keeping track and showing real interest is how I like to
Mhm.
keep track and show real interest. Don't mention something like, are you having a good day? It's like if you stop at the cashier every single time. Good day, how are you? I'm doing good, thank you. I feel so bad for them always. I always think, how many times in a day does a cashier say to someone, I'm fine, thank you, how are you? And that's the last thing that you want to do as a dentist. You don't just want to be the welcome, come on in. You want to remember that the wife, that your patient's wife, his name is Emily. You want to remember that the kids is
Mhm.
John and Julia. You want to remember that this, because making that type of conversation shows that patient that they're not just another patient. They are someone that you're interested in, and that builds trust.
Yeah. Uh, in the UK, of course, you have the you okay.
Yeah. You
Uh,
okay?
You
Yeah, it
okay?
is.
Every time, I think
You
I'm
okay?
okay.
Yeah.
That was I, shoot. I think I'm okay. I don't know. Am I okay?
I had that same experience the first time visiting them. I'm
Mm,
like, you okay? I'm like, it's like, I,
I got something on
I
my
think,
shirt.
am
I
I,
think I'm okay.
I think I'm fine.
No,
uh,
you at this conference, Eric Vickery is an amazing speaker, and he talked a lot about today about you should be interested, not interesting.
mm,
And I think you nailed it with I want you to be interested in the patient's lives. And if you can't, I need you to fake it.
hmm
I need you, if they are wearing, I'm thinking of my dad, if they're wearing overalls and look like they've been working on trains, I want you to be so excited about trains.
hmm
Tell me more about
exactly.
what you do.
Because at
And
the end of the day, it's not about you and what you. It's about the journey of that patient at your practice. That's what you should always keep on the back of your mind. As you just said, as as shallow as it might sound, then pretend as shallow as that might sound, for you running a business, having patients from all different backgrounds, from all different walks of life coming into your practice that are getting different types of treatments, it's for you to tailor that experience to every single patient coming in to make
mhm,
sure that they
mhm.
can walk out there, look back and go, what an amazing dentist. That was a great experience. So I can really tell that they care about me and care about my interests and also my oral health.
Yeah. And I think that anytime, and Dr. Broso used to do this, and as he got busy, it kind of fell off. But one thing he used to do is anytime that he would numb a patient up, he would call them that day and make sure they would check
Mm,
in. And his staff made it easy. They gave him a list of people to call. Had the, I think they even took his phone and saved the numbers in it for him, and he would just call them on the way home. And I asked him one time, do you get a lot of personal phone calls? And he said, no. I tell them, if you have any questions, call the office. And he said they're usually very respectful about that. But like, I think, and I'm not saying these are easy to do, but I think the two most powerful things an office can do to build real patient loyalty is, the first one is, I think on any new patient exam, I want the doctor to call the new patient the day before the interview, or the
mm.
day before the day
It
before the
anchors the level
inter-
of value for that practice, and anchoring is so important. What is that
Mhm.
first initial impression of, wow, I did not expect
Yep,
that the dentist themselves would be contacting me.
yep. And I want them to have the paperwork well in advance, and I want them to say, "Hey, Ian, this is Dr. Hubbard. I'm so excited to see you tomorrow. We've reserved this time for you.
Mm,
We're going to review the following. Listen, the initial exam is going to be about 90 minutes because I want to be incredibly detailed around what you like and what you don't like.
hmm
And I'm going to make sure that this is the best experience you've ever had. I'm not asking you to confirm your appointment. I think that language is just, not what we need. But, and then the other thing is, I want someone from the office to call them that night. Now, I don't think that has to be the dentist. I would love it to be the dentist, but I think anyone who has meaningful work needs to be called. Hey, I
mm.
just wanted to check in on how everything's feeling. Look, a little discomfort at this hour is going to be okay, but if there's pain, you need to call me back at the emergency line.
And that's an example of surprise and delight. That's exactly what we're talking
Yeah.
about. Is someone does not expect a doctor to go out of their way, or one of the staff members to, as you just said, like, how are you doing? Are you experiencing any, like, is everything fine? Especially as you just said, if it's a higher end case,
Hmm. Hmm.
or a high production case that we know, we want to make sure that that experience goes well.
And at the conference, they actually talked about this, and they said, would it be okay to text them? I think a text follow up would be fine.
Hmm
Do I think it is at the level of a phone call? And I know that no one likes phone calls, and but like, we still like phone calls
hmm
for when they're valuable to us.
And I think for what we're trying to achieve here with what we're the strategy that we're trying to explain
Mhm.
to dentists today, and what we're going to get to next about patient reactivation eventually, I don't think a text is going to move that needle for me.
Mm-mm,
That's
mm-mm.
not, if you want to build patient loyalty, if you want to do that surprise and delight, if you want to go that extra mile, a text, I would say, it's not going to have that same effect as hearing the voice of the dentist or hearing the voice of the receptionist or someone
Mm-hmm.
calling in and asking the question, as you mentioned.
Yeah, because the phones are so good now at telling you it's spam or telling you it's whatever. I'm
Hmm.
going to know it's the office calling, and the chances of me at least listening to the voicemail are very, very high.
Hmm.
But yeah, and I think that's actually the most frustrating part when we hear dentists complain about, patients not accepting treatment or whatever. It's because, man, I hate to be so on the nose about this, but they don't trust you. If
And insurance companies is the perfect example for this. I'm not enjoying my existing experience. Now you are calling me and you're trying to shove more product down my throat.
hmm
How
hmm
on how on earth why on earth would I do that? And it's
yeah,
no difference. It's no different if you're a dentist trying to recommend treatments like I was just a number and now you want to
uh-huh.
give me more
Yeah,
give
you've
me more work.
automated a text confirmation to me. You didn't call me ahead of my schedule. You probably ask me the same question multiple times through my new patient journey. What are you here for today? And then the hygienist, what are you here for today? And then
Hmm.
the doctor, what are you here for? Like, there was no cohesion on my experience. I
Yeah.
left. I got an automated review request, which of course, everyone does now.
Hmm.
I come back in, you present $7,000 in treatment, and you're upset that I'm not jumping at the opportunity.
Yeah.
I mean, show a little empathy. If you don't build trust and you drop a 3 or 5 or $7,000 treatment on me, and there's almost this entitlement that because you said it, it must be true.
Hmm.
I, I'm sorry, if there's not trust, I'm not excited to move forward.
Hmm.
And I think that the offices that get it right understand that today I may not be ready for that, but if you invest in me a little bit, if you do learn the names of my kids, if you do learn that I run a company, if you do learn that I really love my Toyota 4Runner or whatever
Or
the case may be.
last time
Uh-huh.
we spoke about my Toyota 4, or I was going to get the newer one. If you remember
hmm
next time, hey, Eric, did you end up getting that new Ford Runner? Man, that goes
Just,
so far.
it is so silly. It's just such a minor thing, but I heard a saying the other day that I feel every dentist needs to understand. It said, the man who enjoys the walk will walk further than the man who loves the destination.
Mm,
And I know that you love patient acceptance, and I know that you want every patient to accept every treatment you've ever given. But if you don't learn to enjoy the walk of their experience and learn to develop that trust along the walk with them, you're just loving the destination of acceptance. You have to learn to engage them in a valuable way that they find value, not in a way that is transactional of, I have 5 minutes in my hygiene check and that was my thing. Take some extra time. We had Brent Cornelius on the other day, and he talked about how his office does these little things like, he's got 3 hygienists, and he makes sure that to put the right personality with the right hygienist, and he
mm,
makes sure that when they come in they greet him the right way, and he makes sure that even when they hand him a piece of paper, it's not on the cheap copy paper, it's on really nice thing of paper, like. And it sounds so
but it's
goofy
so
when you
smart.
think
That's
about
why
it,
I'm
but like,
giggling. But it's so smart. It's so
it's
smart.
so smart because
Yeah.
my wife, who is a tough patient, right? And she left that office, and we've been married a long time, and we've moved a little bit, so she's had 3 or 4 dentists. She left his office so excited, and she even mentioned I didn't have to repeat why I was there, and he
Mm,
explained, and so I think there were 3 points that she really took away. Number one, when she walked in, they knew who she was.
mm,
They're like, "Oh, you must be Emily. It's so nice
mm-hmm,
to see you." Right.
mm-hmm,
And they greeted her. And number two, when they talked to her, they really took time,
mm-hmm,
and they seemed interested in her, things like that. And three, when Dr. Cornelius sit down to talk to her about, her scans and all the stuff they found. And she had this like chipped tooth that they were kind of talking about. And she's had this for about 10 years, by the way. Um, he took the time to sit with her and explain it and asked her how long and asked her how her bite felt and what her job was. And he took the time. And when he said, "Oh, your bite is out of alignment, I think you need Invisalign," which, by the way, she's been offered 3 times already.
Mm-hmm.
Um, she came home and she's like, I really think I need Invisalign.
And
And I was
that's just
like,
because of her journey. That's
it's
just
just
the
because of her
journey.
journey. Yeah.
Yeah. Yeah.
Yeah.
And
And
building that trust. Mm-hmm.
it is. And I think that most of the practices that are struggling with patient acceptance and are losing patients, not reappointing, or having cancellations, I think it's as simple as you have not taken the time to really get to know them, and you've not taken the time to show them the value. Like, you're
Mm-hmm.
trying to be interesting, not interested. And
Mm-hmm.
I don't think that works.
And the big thing that dentists sometimes forget, Eric, and this goes back to what you just said perfectly, by the way. If you don't have that journey, and like you just said, that journey that your wife had and those extra things, you can't expect them to just accept these treatments that you recommend. And if that trust.
That I think if we called a dentist today and said, "Hey, you need to spend 10 grand in ads this month," they'd be like, "What? What? How dare you? What do you mean 10 grand in ads?" And that's effectively what they're doing to the patient. And then they're getting, frustrated that the patient's not jumping at spending 10
Exactly.
grand. Where I think if I said, "Hey, this is what's happening in the marketplace and this is what's happening to your practice, and you've got some holes in the schedule we need to fill,
Mm-hmm.
and I know that you said you want to have a good June, and this is where we're going, and this is part of the strategy that we've laid out, and this is the number." I think then that's such a different conversation. And I think if they even had a little empathy and looked at their own personal behavior of how they negotiate their own contracts and their own partners and their
Mm-hmm.
employees, they would see that they're actually valuing people that have been interested in them. And I just think it's I know it sounds so simple, but I think you just need to take a few extra minutes and be interested in your patients and talk about them at huddle, and really make sure that you take the time to get to know them as people and find a way to enjoy the journey with them, and they will accept treatment.
Mm. So if we can give dentists out there a real action item, I really liked what you kept saying now, Eric, about the huddle.
Hmm.
I know that's one thing that even at our agency is almost a tradition at this point, and it has great value in just getting the day started, knowing
Yeah.
where everybody's at, that we're on the same page. For dentists out there, a real actionable recommendation that I can give at this time to start the journey of surprise and delight, building that trust, building the loyalty, and then eventually working to a patient reactivation or the recommendation of higher end treatments is in your huddles in the morning, start having a schedule where you see what patients are coming in. Work amongst yourselves to understand, who is this patient? Is it a new patient? Is it somebody we've had here before? Go look at the records. Who is the husband? Who is the wife? Did they mention their kids? And to start keeping track of these things, so that
Hmm.
then when we know, okay, Emily is coming in at 9, it's 10 to, even if it takes the hygienist or the assistant or the receptionist just popping into the dentist office saying, okay, remember, this is Emily, husband's Eric, kids is this and this, and they like going boating in Florida. Like, just trying to figure that out. The level of value that can provide, just with
Hmm.
my initial experience walking into your practice, will be so valuable for what we're trying to achieve here long term. So I would
Agreed.
start with that. I would
Agreed.
start with that.
Mhm. Yeah. Well, Ian, this is amazing, and that's a good place to wrap it up. And that was your Bite of Dental Marketing.
Thank you so much, Eric. It was lovely being here.
It's good to be back.
Yeah, good to be back. Florida, baby, it can swallow you whole, but we're it's good to have you back.
Barely made it back.